Welcome everybody. And we are praying. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and county assemblies for the welfare of the society and the just government of the people, we beseech you to behold with your abundant favor as your servants whom you have been pleased to call to the performance of important tasks in the county. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and a faithful manner to promote your honor and glory, and to advance the peace, prosperity, and welfare of our county and of those whose interest you have committed to our church. Amen. Maybe for housekeeping reasons, we are doing the broadcasting live on air. So despite the fact that we are in the assembly, I must take it to your attention that it is a public event at the same time. It is a requirement of the house. Secondly, we would like to capture everything we are talking about here on our Hansard. So when you are using the microphone, kindly please, you have to be very close. Your mouth should be very close to the gadget so that we capture what is happening in the house. We are going to the introduction. Do we have any, before that, do we have any apologies? I can see everybody is present. All members are in the house. Okay, let me bring to the attention of the house and to all parties present that we are integrating. We have an interrogation of the Auditor General's report on the financial statement of Kisumu County Social Health Insurance Fund, financial year 2020-2021. Then we also have another one, 2020, 2021, 2022. Then we have the third one, 2022, 2023. So that is why we are here with the Office of the Auditor General and the accounting officers for the fund. May we get adoption of our agenda? We want to adopt our agenda. Honorable James Were proposed. Honorable Seth Okumu. Our agenda is now adopted officially. Now we are doing introduction. I'm Ken Ouko, Chair, Pickpack County Assembly of Kisumu. I'm a member of West Kisumu Ward. Thank you.
My name is Seth Okumu, MCA East and a member of the committee.
Good morning. My name is Honorable James Umolo, a member of this committee. I represent West Nyakachi Ward.
Morning, everyone. I'm Nancy Macharo Ochieng, a nominated MCA, a member of this committee.
Good morning. My name is James Oyugiwere, MCA for Nyalenda B and a member of the committee. Thank you.
I'm Ruben Okoth Rakwach, MCA Kolwa East Ward and a member of Pickpack Committee.
Good morning. I'm Warindo Joffrey, MCA Miwani Ward, Vice Chair Pickpack Committee.
Secretariat.
Thank you, Chair. I am Austin Ochieng Nyamoya, Committee Clerk.
I am CPA Charles Agengo, a member of the Secretariat.
Good morning. Mine is CPA Nambo Thodero, a member of Secretariat.
Good morning. Weekly Forward, a member of the Secretariat.
Good morning. My name is Mole Nachayo. I'm a certified public accountant and a member of the Secretariat.
Office of the Auditors.
Good morning. My name is Joseph Monique Karanja, Deputy Deputy Director of Audit, Office of the Auditor General. Thank you.
Good morning. My name is David Mtunga from the same office.
Back to the accounting officers.
Good morning, everyone. I'm Ivan Solo, Fund Administrator, Marwa.
Sergeant Atam, we are going to miss the recording in the Hansard. I don't know, maybe.
My name is Joshua Clinton. I'm the fund accountant.
Thank you so much. Sergeant Atam, could you please approach the chair? We want to administer the oath.
I, Ivan Solo, do solemnly and sincerely swear that every word that I shall utter before this committee is the truth and nothing but the truth, that every statement and declaration that I shall make shall be made consistently, believing the same to be true and according to the oaths and statutory declaration act. So help me God.
Thank you. May I confirm from the clerk of the committee, did you get responses from the accounting officers?
Thank you very much. Yeah? We did receive the management responses on time for the 3 financial years. Thank you.
Another office, to the office of the AOG. Did you get responses for the 3 financial years in time?
Thank you, Chair. Yes, we got the responses on time.
Okay. I think at this juncture, we are giving the opportunity to the Office of the Auditor General to give us the opinion of the auditor, then get directly to the first question. Thank you.
Thank you, Chair. This is the report of the Auditor General on the Kisumu County Social Health Insurance Fund for the year ended 30th June 2021. On the same, the opinion that was issued was a qualified opinion, and was qualified on the basis of number one is unsupported revenue from exchange transactions. The other issues were on the emphasis of matter, that was on budgetary control, and the other one was on lawfulness and effectiveness, that was on late submission of the financial statements. I'll begin with the issue, the first issue on qualification, which is unsupported revenue from exchange transactions. Issue number one, the statement of financial performance reflects an amount of Kenya shillings 24,169,840, which as disclosed in note number 1 to the financial statement relates to capitation from NHIF and Linda Mama NHIF. Records provided for audit indicated that these amounts were received through 48 health facilities. The amounts were also traced to the bank and the cash book. However, none of the balances could be traced to the indicated health facilities, as the entity's financial statements did not record any transfers to the fund. In the circumstance, the completeness and accuracies of the reported NHIF, capitation premium, and Linda Mama contributions could not be confirmed.
Back to the accounting officers.
Thank you very much, Chair. This was the management response on audit query 1. Unsupported revenue from exchange transaction. It is true that 24,169,840 was received as transfers from the facilities as capitation and Linda Mama reimbursement. The schedules and MR receipts were provided and verified by the auditors during the audited period. The financial statement from the facilities were not requested to confirm the balances, but the list of transfers from the facilities were provided. The transfer ledgers are attached in Appendix 2. Thank you.
Back to the auditors.
The verification has been done for that response, and management provided a schedule of the transfers for the period and the MR receipts. However, we could not trace the transfers to the indicated health facilities.
It's like you are reading from a different script. The matter is not addressed. Before I give to members, do you have anything to say? Because they are confirming that whatever you claim to have provided, it is not convincing. You have something to say? Not only you, but you have the officers with you, they can.
Thank you, Chair. We provided the MR receipts and the bank statement showing the transfers of the funds to the facility. As the fund management team, we are only responsible to account whatever was transferred to the fund account. So as per the auditor's view, we did not, the auditor stated that the amounts were not traced back to the specific facilities. So meaning that the financial statements of those facilities were interrogated and they couldn't find the finding. But as the fund managers, we can only account for whatever was transferred to us from the facilities, and the bank statements confirmed, the cash books also confirmed, the MR receipts also confirmed that indeed we received the monies from the facilities. We have also provided the empty bar reports based on the invoicing from the facilities. So that one you are not able to tender it on time. but we have the report also here so that the amounts, we can confirm that indeed the amounts that were being transferred from the facilities were actually invoiced based on the MTBA platforms. Thank you.
Members?
Chair, get the response of the managers of the fund, and they're saying that once the money gets to the facility, they don't care. If I was getting you well, Clinton, it's like money goes to the facility, then after that you don't care. You're just a conduit. Whether it's being embezzled, whether it's being used prudently, you just don't care. And I don't think that's what you should do in a fund, because you are responsible for making sure that this fund does the intended purpose. But if you just want to be a conduit, then why should we have that fund? People who do not want to control what the fund does after the fund leaves their hand. That's what the auditor is telling you. So we rather just give the money to the facilities direct and then audit it from there than giving a fund which does not give any consideration after money has left their hand. I think that was a very sad statement, that you're only responsible for giving them. Then after that, you sit back and then you just wait for whatever they do with that money. Chair, that's my comment.
Chair, I'm a bit lost. The Auditor General, I think for the incoming funds to this fund account, they have provided the bank statements and you can see the incomings. And if I heard the Auditor General clearly, they were asking, after the funds have arrived, the 24 million, how did they arrive to the various accounts of these facilities? There is nothing to show about it after receiving the various amounts. So maybe as a layman, I need to know, these transfers were to this fund account. The beneficiaries were the facilities. Or if they were, then at what point did they leave their fund account to the facilities, and did they receive? Because from his point, it's like the end user of this money should have been the facilities. So I'm a bit lost, but I think if it is cleared, I'll get where we should be. Thank you.
Let me give it back. You know, as an entity which is actually given the responsibility to administration this fund, it is very clear. Now, you people, did you receive the money or this money? You know, it's like you don't want to talk about some money which was somehow given to you, then who disbursed this money to the facilities? Because we expect you are the administrators of the fund. Now, what is happening?
Yeah, the money dispersed to the facilities as indicated in the audit query as part of Linda Mama and capitation. So the money went to the facilities and then were transferred back to the fund account. In Maro regulation, one of the sources of fund is the capitation from NHIF. So Marwa, by that time, was not a master capitator. So the monies were being transferred to the facilities, and then the facilities transfer monies to the fund account. During the audit period, we were able to provide the capitation list showing how the funds were transferred to those facilities from the NHIF, and also bank statement now showing how the facilities transferred the funds from now the facilities to the fund account.
I'm getting something from the Auditor Generals. The amounts were also traced to the banks and the cash book. However, none of the balances will be traced to the indicated health facilities, as the entities' financial statements did not record any transfer to the fund. What can you say on that?
From the statement from the OAG, it shows that they audited the financial statement of these entities and they could not see any transfers to the facility, to the fund account. That is why I was saying for us, not that we don't care how the monies are being transferred to the facilities, but at the fund account, when I'm preparing the financial statements, I account for the monies that were received to the fund account. But now to the entities, the responsibility of the preparing the financial statement is really based on the accounting officers of those entities.
Any member? Honorable Rakwach.
Thank you, Chair. Chair, there is a point here that I don't understand. Like if you check the statement on this date, 28th, uh, 28th May, this 3 million, which is indicated in the list here, 3.3 million to have originated from Chiga Health Center. If you check on the statement, this description, there is nowhere written Chiga. It is just in-house and some codes there. So maybe the management can understand that one. It can make us understand that one. If you go on also the 2nd of June 2021, there is also the same 13,500, which here it is not attached to any facility. But if you check on the list given here, I think it corresponds to Magena Health Center. Now, I wish that the facility matches or explains for us so that we understand. And then another question, maybe I stand to be educated by the management, because I think the facilities receive this, during disbursement, the facilities receive the money, then they transfer it to the fund account. Then from the fund account, it goes back to the facilities. Is it true? So I think there is nowhere indicated how much went back to the facilities. So I don't know whether the money was received in the fund account and then it just remained there and it is still there up to date. So I need that. Then the third question, I hope the management is noting. The first was on this in-house things, the transfer of 3.3 million, then the 15,000, which is not matched to any facility. My second question was on the transfer back to the facilities, which is not indicated anywhere. Then my third question, I want to understand what determines the amount of money goes to which facility. Because as I want to believe it is based on the load of the facility, how many people the facility handled. I think that is how these amounts are coming about. But when you compare like Chiga is in my ward, and Nyalonya is in the neighboring ward, Kolwa Central. I know the load in Nyalonya is much higher than the load in Chiga Health Center. But here you get the transfer to Nyalonya, it's only 570,000. And then the transfer to Chiga Health Center is 3.3 million. So that disparity, I really need to understand so that we know. Thank you.
The questions, some are not in the audit queries, but maybe will form the basis of what we are talking about. So kindly respond.
Chair, the bank statements, we request them from the bank, and some of them transfers, they are just indicated as inwards. It depends with the description that the facility in charge puts in the bank transfer forms when transferring the funds. So, but when we receive these funds, we are able to know that these funds we have received them from this facility because immediately we issue facilities with the MR. Once we are given the facility, the MR, we go ahead and prepare the transfer ledgers, the schedule that we have attached. So that is how we are able to know that these funds are from this specific facility. But normally the bank statements appear the way it has appeared. On either that there are some funds that are being transferred to the facility, I can say yes. The funds are transferred to the facility based on the amount billed. We use the MTBA platform, which we run in each and every quarter, and based on that, the total amount billed, we transfer the same to the facilities. It is based on a patient come to the hospital, it is billed on the MTBA platform, then the money is transferred to the facility. If you look at our financial statements, we are still addressing the issues in financial statement for the year 2020-2021. But if you go through the financial statement 2021-2022, you will see an item called user fee. So that is the amount of monies that were transferred back to the facilities based on the amount billed on the MTBA platform. What determines what the facility get? During the initial stages of Marwa, when these 45,000 indigents plus the dependents were enrolled, the NHIF members were being sent to each and every sub-county to register the members. So how the amounts are being, how the capitation were being allocated is based on how many members were being attached to each and every facility. So you'll find that around Chiga, a number of white people were registered and they were attached to the closer facility next to them. The same to Nyalunya and the other facilities. Thank you.
I think there is something which is not still clear, and I think Honorable Akwach has said it. Once the money arrives in this account as per the schedule and as per the bank statements, what happens to it? How does it go back to the facilities? And in this statement, bank statement, we have a balance, and that balance is constant. There is no money out of this bank statement. So I think Rakwach has asked it, and that's what I really asked. What happens after the money arrives in this fund account in respect to the facilities that should be the beneficiaries?
So the amount is budgeted for. You can see as per that bank statement, that amount is constant because much of it were received in the month of May and June when the financial year was coming to an end. So there is nothing we could have done. But if you proceed to the financial year 2021-2022, you will, and I've also referred you to the financial statement of 2021-2022. Now, you will see in the bank statement, in the financial statement, there's an item called user fee. That is how that amount was being now transferred back to the facility. Now, based on the billing, how many members visited the facility? How much did they consume? So we transfer based on the amount of money that the indigents consumed in those facilities. The rest of the amount of money we are using to buy medical drugs, and you'll see an item called there medical drugs, laboratory reagents, which was done in a pool, then distributed to these particular facilities. We were doing that because these facilities, they are not procurement entities. They can't procure on their own. So the only way we could have salvaged them is to what's called benefit economies of scale. When you buy in bulk, and now you support all the facilities in Kisumu County. Initially, we had 49 facilities enrolled on Marwa, but when we purchased these particular drugs and non-pharmaceutical, we not only now look at the facilities that are enrolled on Marwa, but we are also supporting other facilities that are also that are in need, because all of them, the primary health care is free in Kisumu County, and they needed the support from the County Department of Health. So when you move to 2021-2022 financial statement, I think you will see how now the money was being utilized. Basically in 2021, we did not spend any money apart from the bank charges, of which is 2,158.
Honorable Member.
Thank you. I know this one is too, my question is too small and easy for the director. Yeah, I just want to know if the situation like this arises, how they go about it. Because he has said that they transfer the money back to the facility based on the billing from the facilities. At the same time, the remaining amount they use on drugs. If at all, the purchase of drugs plus the billings from these facilities do not match the money which is in the fund account, what do you do? A case whereby maybe the billing plus the purchase of drugs is higher than the amount which is in the fund account, or maybe less than, what do you do in such a scenario? I know if it is less, there will be some money left in the account. Where do you take the money? And if it is higher, you will have a shortage. How will you address the two scenarios? Thank you.
Director.
Thank you. If the amount, the fund cannot spend more than what it has, we have to spend based on the budget. And therefore, we budget based on the availability of the funds. So we look at what need to be transferred vis-a-vis the facilities that need to be supported in terms of electricity, water bills, and medical drugs plus non-pharmaceuticals. In preparation of the financial statement, if there's amount of money that is left in the account, when the financial year is coming to an end, it is carried forward to the next financial year.
Honorable Molo.
Yeah, apart from the from the statement, the bank statement, we have the receivables, which are 24 million. And then in the same fund, we have donor funding. I think in this case, farm access majorly. The donor funded one and the ones coming from the facilities, does it, the entire total, does it now, the recipients are the facilities, all of it, plus what you are saying that you have to pull and procure on behalf of the facilities. Is that correct? Thank you.
Yes, Honorable Joinla. Honorable Kumu.
Yeah, one, I'm not convinced that it was hard to transfer money back in the facilities in 1 month. That if you get money in May from the facilities, you can transfer it back to those facilities so that they can use it. I think that's what the auditor is asking. You receive the money, but you refuse to give back to the facilities. And the reason you are giving back to the facilities is because they offered a service. And that service is being compensated by Linda Mama and NHIF, if I'm correct. And that means there are standard rates in which they offer these services. But now when it comes to now giving them back the money, if I get you right, you're saying that you're now using a different formula again now to give back the money to these facilities. Now they might, if for example, Chiga was given 3.3 million by Linda Mama, that you are not going to transfer back the 3.3 million. You're going to transfer less based on a formula that you're talking about. Yet, Linda Mama was given to Chiga based on the services it provided for some women and children, and that were now refunded back to them. Why are we doing this? Is it really fair for Chiga to get less money than the services that they offered? Thank you, Chair.
Is it within the regulations?
Thank you, Honorable Seth. I want to start with the question that was raised on the donor funds. In the year 2021-2022, I think we didn't receive any donation in 2020-2021. We didn't receive any. And but in the subsequent year 2021-2022, I think there was donation of around 53 million. We'll get there, we'll see. This money was received in the fund account. Our donors wanted Kisumu County Department of Health to co-fund. So Kisumu County was to pay some money into the fund account, and also our donors, in this case Farm Access, transferred some amount of money into the fund account. Cumulatively, the fund was to transfer the funds to NHIF to pay premiums for the 42,000 indigents plus the dependents to cater for their health insurance. So the donor funds comes in to the fund and gets out to NHIF. But in 2020-2021, there was no donor funding. The capitation, if I may take you back, in the MARUA regulations, under sources of funds, we have capitation and monies from insurance from the facilities. The reason why we were doing this, we were trying to ring-fence the monies in the Department of Health because by that time, there was no FIF. So even the collections in these facilities, they were to be transferred back to the CRF account. So getting this money from now the CRF account was a tall order. So we decided that let the monies be transferred to the fund account so that they are utilized within the Department of Health. Whether we are fair, the capitation that we are receiving, capitation is received based on the premium paid. We are paying premium of 1,500 per quarter, but NHIF is giving us capitation of 250 per head in a quarter. So based on the number of people that are capitated at a given facility dictates what that facility gets. But remember, if 3,000 people are capitated in Chiga, all of them may have not gotten services in Chiga within that particular period of time. But there are also other facilities like Anding Opanga, who is not actually benefiting from this fund, but need electricity to pay, need also medical drugs. So that is why we consolidated all these funds so that we see how we can take care of our primary health facilities. Because all these indigents, you'll find that an indigent, we were not restricting them to get services in the Marwa capitated facility alone, but they are also getting services in other facilities. So how were we to support also these other facilities is bringing the funds back, and now we are reimbursing the Marwa capitated facility based on what they have billed, and then on top we also used to top up with the drugs and non-pharmaceutical. So the amount that they were billing basically was now to take care of their pay the casuals and maintenance of station and building. But during that particular period, we were paying for them electricity, we were supplying them with drugs, and also with non-pharmaceuticals.
We are proceeding. We'll make a determination on that. We understand some of the issues here are beyond your control. We just see that some are beyond your control. Because before the coming of 2021 issue, this fund was not controlled by you people. It was controlled by somebody else. Yes, yeah.
But I'm jumping the gun. Facilities. Yeah, there are facilities. A case in point, we have Kosa Health Center, we have Kosa Dispensary. I come from Nyakach. Kosa became Kodingo in the year 2016 or 2015. I was in the member of a county assembly then. We had to change the name because the word Kosa comes from another word. So even appropriating money here was a problem. So we had to change the name to Kodingo. But from the latest disbursement, I think in 2022, I'm seeing Kosa Dispensary and Kosa Health Center. Kodingo is there, yeah, but these two Kosas, maybe they can clarify. There used to be Kosa Health Center, there used to be Kosa Dispensary, but they were all Kodingo. Now we have Kodingo. The two Kosas should not be there. So I just want clarification on that, please.
Maybe if you still have a register containing the same name from different areas, maybe the changes were not made.
Thank you. I'm aware of what Honorable is talking about, and as far as that is not changed in the NHIF and the coding is still reading KUSA, the money, the facility will still receive the fund under the name KUSA. But I think of recent, we were able to do what's called change of name in the NHIF forms and also in the bank, because you have to change the bank account name and also the NHIF code so that they all conform. So, but by that time, the monies were being transferred, read the name KUSA.
Yeah, that one is understandable, which means we have 3 accounts for the same facilities as per what you are describing, and then they receive in these 3 different accounts. The Kodingo Health Center receives, Kosa Health Center receives, and Kosa Dispensary receives. All the 3 accounts belongs to one facility, if I'm getting it clearly. Is it?
All these 3, I think KUSA is only having, they used to have 1 or 2 accounts. I'm aware. There's an account that I think they opened when they were dispensary, and there's an account when they opened it's a health center. So once a facility has been upgraded to a health center, the contract with the NHIF changes. So that's why maybe in the disbursement, you can see a disbursement reading Kusa Dispensary and also Kusa Health Center. But I think the one for Kusa Health Center has since been changed to read Kodingo.
Okay. We can proceed. We'll make a determination on that. We really appreciate the need for equality and equity you are trying to show, but it is disadvantaging some kind of those hardworking facilities, like the one being claimed by Rakwach. It's not in favor of what the kind of services being given, to slash somebody's contribution to save someone. At least even if you are slashing something, this will be reasonable. This will not just slash something different. You work oppositely. That is quite unfortunate. That would also discourage staffs working there. I hope you understand. But we'll make a determination on that. We realize there are some things here which are beyond your control. Question 2. Back to the Auditor General.
Issue number 2. Issue number 2 is on emphasis of the matter, which is on the budgetary control and performance. And the statement reads, the statement of comparison, budget and actual amounts reflects final receipts, budget and actual of a comparable basis of Kenya shillings 24,169,840. Similarly, the fund expended Kenya shillings 2,518 against a budget of the same amount. However, no approved budget was provided for audit review. This was contrary to Regulation 43.2 of the Public Finance Management County Government Regulations 2015, which states that county government entities shall execute their approved budget based on the annual appropriation legislation and the approved annual cash flow plan, with the exception of unforeseen and unavoidable spending dealt with through the county emergency fund or supplementary estimates. Thank you.
Back to the accounting officers.
Thank you, Chair. Management's response on the raised question. This was well acknowledged, and the management shall forever ensure that all budgets are approved going forward. This was the first financial year the fund and financial structures were being put in place. The report of amount 24,169,840 was received in the amount when financial year was coming to an end, and therefore it was not possible to budget. The funds were, however, budgeted for in the subsequent year. 2,518 shillings that the fund expended was the bank charges only as provided for in the ledger. However, these funds were later budgeted for in the subsequent year as attached in Annex 1. Thank you, Chair.
Back to the data.
Thank you, Chair. Management has not provided an approved budget for the year under review. However, in the subsequent year, an approved budget was provided.
From preparing a budget for this financial year, knowing very clearly this is an entity which is funded by the public fund.
Thank you, Chair. Marwa started in 2021. That's when Marwa started. And in this particular period, we were still putting in the structure and how the funds will flow. So as far as at July 2020, we thought that the money will be, of course, Kisumu County budgeted for these funds. If you look at the budget for that particular period, it is within the budget of Kisumu County for Kisumu County Social Health Insurance Fund. But that was in the main account, the CRF account. So we were not foreseeing a case where we are going to have to go on what's called a supply side of insurance based on the difficulties that we were experiencing, since now we were not able to get monies from the CRF. So when the year was coming to an end, that is when now NHIF, based on the insurance that were paid, the premiums, NHIF disbursed capitations to the facility. Actually, it was done in April. So in that particular month, we were not able to come up with the estimates because the year was coming to an end. But we received the funds, we produced the schedules and the bank statement, but we budgeted for these funds because we didn't spend any money during that particular year. We carried forward these funds and we budgeted for them in the year 2021, 2022. We, however, acknowledge that whichever the case, the management should have come up with the estimates for any unforeseen.
But you are trying to say, you are trying to confirm that because the year you were not able to come up with a budget because the year was coming to an end. Was there anything stopping you from having a budget before the year ends? Because it's a confirmation that you did not do that because of the year was coming to an end.
Thank you, Chair. Oversight Committee. Hmm? 2022.
Any member? Request.
Thank you, Chair. Chair, I only have two questions. Or maybe two issues with this question. I think the management has responded well, that the money came when the financial year was almost coming to an end. And since the budget had been done, the supplementary budget was also long gone, it could not be budgeted for the same year. But in the subsequent year, it was budgeted for. But here, there is no evidence showing that budget of the subsequent year. So maybe they can tell us something about that, because it is just stated, but there is no evidence. At the same time, on this money, the 2,500, which is purported to have been a bank charge, is also just indicated. I think the same list we have under question 1 is the list that has been repeated here. And then down there, they have indicated proposed expenditure, bank charges, 2,518. There is nothing, or not even a bank statement showing that the 2,000 518 was a bank charge. Thank you.
Yeah.
I think if I'm not wrong, the bank statement has been provided. If you look at the same bank statement confirming how the funds were received in the fund account, it has the same bank statement. However, in the bank statement, the bank charges are occurring different in different dates. But we have a schedule showing how we came up with the 2,518 is indicating at the bank charges. The budget for the subsequent year.
Were the indications very clearly provided?
The bank charges.
Schedules for the were they provided?
They were provided during the audit for the bank charges, and that's why they are not a query.
But now that for the house now.
For the house, we can provide.
We need that.
We can table again. I have a soft copy, sir.
Because we are questioning. When you question.
Yes, I have a soft copy, so we can
we
provide.
Advise that you provide them.
Yes, sir.
Okay. And now we have a question on statements.
Yeah.
You have said it is provided in 2021, 2022.
Yes.
Yes.
It is an attachment in that
if
subsequent.
It is there, now we'll answer that question.
Okay.
As we go to that.
So.
Thank you. Question 3.
Thank you, Chair. The final issue is on late submission of the financial statement, and it reads as follows. Kisumu County Social Health Fund annual report and financial statement for the year ended 30th June 2021 were submitted to the Office of the Auditor General on 23rd November 2023, which is approximately 26 months late. This is contrary to Section 81(4)(a) of the Public Finance Management Act 2012, which states that not later than 3 months after the end of each financial year, the accounting officer for the entity shall submit the entity's financial statement to the Auditor General. Thank you.
To that, yes.
Thank you, Chair. This is our management response on the query that was raised by the Office of the Auditor General. The management acknowledges laws guiding the submission of financial reports for auditing by 30th of September. And late submission was due to the fact that the fund should be receiving appropriated by the county, which has never been the case. Thus, the management did not have clear information whether to submit the financial statements to the Office of the Auditor General, since the Kisumu County Social Health Insurance Fund was not among the entities that were to submit their financial reports in the list provided by the county treasury. We however apologize for the late submission, and this will not occur again going forward. Thank you.
Back to the members. Back to the auditors, I mean.
Thank you, Chair. I think the management did not adhere to the laid down laws on submission of the financial statements.
Back to the members. Director, this is a requirement of law. Even if you don't know, you don't expect to, your financial statement for the year, you have to comply. You don't contravene. How comes you did not, and being an accountant? Rejoinder. Who signed the statement?
I signed the fund accountant.
If Clinton signed the statement, is he confirming that he does not know that there is law that provides of when to submit financial statements? And is he also acknowledging that he does not know that funds are supposed to be audited? Those are my two questions. Thank you, Chair.
You can crown it up.
Thank you, Chair. Indeed, I'm aware that is within the regulation, that within the law, that we should have provided the financial statements as indicated period was created as a regulation, meaning by law, if we have money that have been appropriated from the CRF account, then we should have prepared what's called expenditure and income account or statement of financial performance, then take to the treasury, then together they consolidate, and it should be part and parcel of the financial statement of Kisumu County as a whole. But as I indicated, that one was never the case, and as a fund, we later acknowledge that it is our mandate to prepare the financial statements. And that is why we have apologized. We are against the law, but I think this one will not occur again. I think this occurred in 2021, 2022, 2020, 2021, and 2021, 2022, where we submitted our financial statements. But for 2022, 2023, I think the financial statement was submitted on time.
Chair, I get the submission of Clinton, but I just want to remind him, just because you kill someone and the law has found you, but on the subsequent disagreement with other people, now you went to court, does not make you not responsible for the person you killed then. So we are still discussing the financial year ended 2021. And I just don't want you to go without noticing that you are misleading this house, because Marwa is a fund that was created out of Kisumu Health Act, and we created a fund out of it. So saying that it was going to be audited together with the department, to me, that is misleading the committee. So I think you should have known then that all funds, emergency fund, bursary fund, Marwa fund, whatever fund we have in this county, is audited as a fund, not as a I don't know, a hang-on a department or something. So I think your explanation that it was supposed to be done that way, to me, it's wrong and misleading. And Chair, I don't think that should go without telling him before the committee. Thank you.
I think despite the fact that you have apologized, that does not give you the audacity to go against the law of the land. It is very clear. Public Finance Management Act is very clear on these issues. And being an accountant, we are aware you must go through these things, and you are aware about what should be done. And the concern is very clear. Yes. Could you please read that? You know the consequences.
Thank you. In regards to that, Article 229 of the Constitution of
We are done with the financial year that ended 30 June 2021.
Thank you, Chair. This is the report of the Auditor General on Kisumu County Social Health Insurance Fund for the year ended 30th June 2022. The opinion that was issued was a qualified opinion, and the following are the issues. Number one is on unsupported expenditure on insurance cost. It reads as follows. Included in the expenditure on use of goods and services is an amount of Kenya shillings 63,846,000 incurred on NHIF registration paid on behalf of 42,564 members of society indicated to be indigent. However, the management did not provide details on how the members were identified and how the identified members were each granted an equal amount of Kenya shillings 1,500. In the circumstance, the completeness and accuracy of the disclosed amount could not be confirmed.
Back to the accounting officers.
Thank you, Chair. Management's response on unsupported expenditure. About the insurance cost. The process of the identification of indigents is broad and entails a number of steps. The data was obtained from the Social Protection Department on the vulnerable people in Kisumu County. However, community health volunteers were then involved to confirm whether they are indeed deserving. The final list was then submitted to NHIF for verification before payment. Payment for premium of Kenya shillings 1,500 per indigent per quarter was made on the NHIF policy of paying premiums for super cover, which 500 per month. Kindly find the attached details on how the indigents were identified and amount allocated in Annex 1. Thank you.
Back to the auditors.
After the verification of the response, management has not provided full support on how the indigent were identified and support for the NHIF policy on paying of premiums.
The Office of the Auditor General is confirming to you. But you did not provide what was expected, the full list of what is expected.
Okay, Chair, thank you. Dr. Fanis will handle that.
Okay, thank you, Chair. We have evidence of payment of the 63,846,000. That was basically donor money from Farm Access Foundation that was paid directly to NHIF to be able to support 42,564 indigents. So this amount did not go through the fund. It was paid directly from Farm Access to NHIF, and that document is available. As per the 42,564 indigents,
which document is available? You know, when we don't talk about hearsay, we present the document if it is there.
I have it in soft copy, Chair. Allow me.
But Chair, did they give it to the auditor? And what authenticates the soft copy?
Yes.
Come again, please.
Why did you not provide the soft copy to the auditor in time? And what authenticates the soft copy that you have right now?
So we were able to get the documents because we didn't have the documents in our disposal. We had to get it from the payer, that was Farm Access Foundation, and they were able to give us the necessary documents, which we forwarded to the accountant.
Payment done by Farm Access direct to NHIF again comes under the fund, because we had said, and I remember Clinton mentioning that the sources of this fund were NHIF, Linda Mama, I don't know all those things, appropriation from the assembly. Now Adona decides to give us money, but doesn't want the money to come to this account. Is it still money that's supposed to be audited with this account? Do we still consider that money to be part of what we are talking about? Because if I decide to pay for somebody insurance as a person, I decide to pay for some 3 old women, then I come and tell you, please start reporting on that. Will you do that? Thank you.
Okay, Director, I see you have something to say about that.
Thank you. I think the first amount of amounting to 126 million was paid directly by Farm Access to NHIF. That one was 2020. But now the arrangement of co-funding was put in place where they transferred 59.1 million into the fund account. So Kisumu County was to co-fund, but you are not able to do that due to delay of disbursement from the National Treasury. So the amount that has been indicated of 63, that amount of 63,846,000, we had now to top up almost 5 million out of the 24 million that have been now transferred, carried forward to this financial year, and the money was paid directly now from the fund account, and that is why it is appearing as a query. On the identification, the identification started way back in early 2020. And during this time, our partners were involved. And as we have indicated, the data from the Social Protection Department was provided. And what is in question was, how did we now come up and identify the 42? The 42, it was 45,000 indigents. We got that data from the social protection, and the data is a list that we provided with the auditors, a list of 45. So the CHVs were therefore mandated to go and confirm that indeed these people are deserving. And there's something called means testing tool that we used. So that means testing tool is attached. If you look at this attachment of that means testing tool, that one now has been provided. During the time of audit, I think we were not able to...
On a point of order, Chair. I think what Clinton is saying is very, very good. But the auditor is asking, he's saying that you did not provide that. You're even saying that we started the process of getting the indigents in 2020. But now we are in 2022.
Yeah.
And you could not provide how you arrived at the indigents. Question is why? Just providing, we went through this process to get the 564 indigents. This is what we use. There are only 2 concerns here. That you did not provide how you arrived at them, and you did not provide how you decided to have a flat rate of 1,500 for all of them. And even now, you've not provided to them. And the question is why? Is it something we are hiding? Is it how we are coming up with 63 million being paid direct to NHIF and not through the account? Why are we hiding how we arrive at this 42,564 indigents? Because just telling them this is how we went through, these are the parameters we use, this is how we spread them across the county. And these are the people now. Thank you.
I proceed.
You proceed.
Thank you. I was heading there. We provided the list of these indigents, 45,000 of them that was later given to NHIF in soft copy to the auditors. But now what they were asking, what criteria did we use? So that criteria, we have attached it, criteria that we used, that now our CHVs used to confirm that indeed this data that we got from the social protection of these 45,000 people, they were really deserving to be supported. On the issue of how we paid 500 per quarter, during the audit period, we provided the agreement between Kisumu County Department of Health and NHIF. And I'll provide the agreement, and this one is within that MOU, that these Marwa people will enjoy super cover. Each and every member of this country, there's a super cover payment of 500 shillings per month. So we are paying for 500 shillings per month. In a quarter, that comes to 1,500 per person per quarter. So Chair, if you allow me, we didn't carry the MOU, but that MOU, we can provide it given time, setting the amount.
Chair, going by this verification checklist, they're saying all our indigents are using wood as the source of fuel, and then they're living in dung, mud, or soil houses, and then their floor is earth and sand. If I was to get, I don't know if that's the interpretation, that all the 42,564 indigents that we are paying for do not have electricity, are only using wood, and they have education that is not more than secondary school. Is that the interpretation of this checklist? Just to, I'm not talking about the responses. If this is the checklist that we used for verification of the indigents, then we believe everybody that we picked, the 42,564, must, one, not have an education level not more than secondary school. So they are primary, maybe up to Form 3. In fact, not even, they are all primary school. All our indigents are only primary school leavers. Then all their houses do not have electricity. Then they don't have latrines. They are still defecating in the bush. And their houses are either dung, mud, or soil, and they only use wood as source of fuel. Is that the interpretation for the 42,564? So if we pick from that list that you gave to the auditor, and we do a random check on some of the beneficiaries, the indigents, and we find something contrary, would you still take responsibility? Chair, I just want to inform her that the responsibility of this fund lies with the management and the identification of recipients. You are just delegating that responsibility to some people. But if you find that one of those people is an MCA or a teacher, which does not meet this criteria, then you should be responsible because you should be verifying the information that you're getting from those that you have delegated. And if they are giving you wrong information, just know that the responsibility lies with you.
Yeah, Chair, I think actually that is what the auditor is looking for, so that we can be able to verify on sample basis. And again, there is a score of the household, which is out of 6. We'll be able to know those people who are receiving this service or this cover, are they meeting this score of 6? Thank you.
Thank you. Thank you, Chair. The concern of these members are very valid and we really appreciate. To actually confirm whether they are deserving or not. We did not leave it at there. We presented the list to the NHIF and NHIF did further verification. And if you are MCA and there's someone contributing for your cover, automatically the system of the NHIF knocks you out. And that is why this list, it was 45,000 initially, it came down to 42 because there are people around 253, 2,500, can't remember the figure very well, that were knocked out based on that they were having other insurances. So they were knocked out. But we keep on working on the tools every now and then. And even right now, we are picking from what the national government is going to use as mean testing and also verify, confirm with what we have, that we arrive at the people who are really deserving. If you do a spot check right now, Mr. Chairman, the status of economy of individual changes. And maybe there's someone who used to live in a mad house and got a support from a MCA, and right now is living in a very decent house. But we have videos, we have testimonies of the people that have been benefiting from Marwa, from Kisumu County website. We'll be able to provide those ones to confirm that indeed some of these members are really deserving these services.
We must confirm to you that we are retreating for
Thank you, Chair. The next issue is on procurement of ICT and networking. It reads as follows: included in the use of goods and services, and as disclosed in Note 4 to the financial statement, is an amount of Kenya shillings 2,427,280 relating to ICT and networking. In turn, this amount includes Kenya shillings 1,627,400 paid to a firm for the supply and delivery of 103 computer tablets. However, requests for quotations from suppliers, tender opening reports, appointment of tender opening committee were not provided for audit review. In addition, the list showing how the computer tablets were distributed to the health facilities was not provided for audit review. In the circumstance, the validity and accuracy of the expenditure of Kenya shillings 1,627,400 could not be confirmed.
back to the accounting officers.
Thank you, Chairman. Management's response on the query raised by Office of the Auditor General on procurement of ICT and networking. Management regret that requests for quotations, suppliers, tender evaluation reports, and tender opening minutes were not availed for the audit. This happened because the documents were mistakenly mixed with the already audited documents from the previous years. The management wished to report that the documents were later retrieved and attached to the vouchers as indicated in Annex 2. Thank you.
Back to the auditors.
Management has not provided the list of how the computers, tablets were distributed to the facilities. In addition, no support was provided showing that the facilities received the tablets.
Lying to the House.
Was missing, but I've since provided that list in a soft copy. I've just shared it right now. I've just received it right now.
Back to the members.
In fact, Clinton is saying that he just received it right now and he just shared it right now. I don't know with who and for what purpose. And who is this person who was hiding it? That is where our problem started. Somebody just decided to keep it to the auditors, keep it for the assembly until we now ask the question now is sending it to you. I think that's somebody that we need to really make responsible for his mistakes, because I think it's somebody who is doing, it's sabotaging this fund. Two, Chair, I've not seen it, so I don't want to talk about something that we've not seen and the auditor has not seen unless they confirm. there is nothing to show that the whatever you bought, the Alcatel tablets, reached anyone. As we sit here right now, there is nothing before this committee or the auditor to show that the Alcatel tablets that were bought reached anyone. And if it reached anyone, then you have failed to provide. And we assume that the 1.6 million, somebody just bought some things and kept in his house. Because by giving us that list earlier, Chair, we can even confirm with those people that it's being mentioned here that you received a tablet. Did you really receive it? And they tell us, yes, we have received it. But if you're saying that you give us a list right now and we can't do anything with it, then we consider that the tablets were not given to anyone. And we agree with the observation of the auditor. And somebody has to be made responsible. Thank you, Chair.
Maybe admin has something to say.
Thank you, Chair. Allow me to follow it up after this, but it's good. We regretted that happened, and in future, we'll ensure that the house is in order, because it's just now that the fund accountant has received the list, and maybe we'll also submit the same to the committee for verification. And from our end, I believe maybe from the auditor's end, they've also received the same, but it was an oversight. We'll follow it up as management. Thank you. Yes, we did.
Sorry, Chair, we didn't ignore what was reported by the Auditor General. And I request you, sir, this list, I've just received it from the person who was responsible in terms of distribution of these tablets way back in 2021. So she was also taking time retrieving it back. But I think during the time of audit, the auditors were able to go to our stores and verified the S11s. S11s is a document that's showing how the tablets were issued. So the only thing that was remaining was the list that, as per now, it's now available. And if you allow us, we'll be able to table it.
But Director,
send the information to you right now. Yeah, that's what I wanted him to clarify.
Yeah, the list has been shared with me from the officer who by that time was responsible for distribution of these particular tablets.
Yeah, the officer has a name. Reports. How you as it was 22. Continue with Auditors General. Chair, before we continue, I'm looking at the procurement document. Chair, what was evaluated, if I'm getting this right? Chair, on the tender document, what was evaluated by Monica Owuor, Philip Nyumba, Elizabeth Akuku, Leah Mokori, and Isaac Owino were 3 firms, and I'm happy that Brands Media was one of them and is the lowest bidder. But they had evaluated 7 screen size, 8 GB ROM, 1 GB RAM, battery capacity, 2,580. There was supposed to be 156 at 15,800. And that was bringing it to 2,464,800 for Brands Media. Maybe they help me understand how this reduced to 1,627,000 when it came to the actual deliveries, unless I didn't get other documents right. Thank you, Chair.
Yeah, for a quick one, you can answer that.
Thank you, Chair. There is also a credit note attached to that, confirming that the supplier supplied less tablets. There's a credit note, meaning that the supplier did not bring the 156, but delivered 103. So we only pay for what was delivered.
Thank. Next question.
On emphasis of matter, that is a recurrent issue from the previous year, which is budget control and performance. It reads as follows. The statement of comparative budget and actual amounts reflects final receipts budget and actual on a comparative basis of Kenya shillings 64,828,224. Similarly, the fund expended Kenya shillings 86,616,361 against a budget of the same amount. However, no approved budget was provided for audit review. This was contrary to Regulation 43(2) of the Public Finance Management Regulations of 2015 that states that county government shall execute the approved budgets based on an annual appropriation legislation and the approved annual cash flow plan, with the exception of unforeseen and unavoidable spending dealt with through the county emergency fund or supplementary estimates. Thank you.
I can see the management has now provided an approved budget. Was it provided? It was provided.
Yes.
So we skip that. Unless somebody has something. Go to another.
The other issue is on lawfulness and effectiveness, which is on late submission of the financial statement. It's a recurring issue as well. It reads as follows. Kisumu County Social Health Insurance Fund annual report and financial statements for the year ended 30th June 2022 were submitted to the Office of the Auditor General on 23rd of November 2023, which is approximately 26 months late. This was contrary to Section 81(4)(a) of the Public of the PFM Act 2012, which states that not late than 3 months after the end of the financial year, the accounting officer for the entity shall submit the entity's financial statement to the Auditor General.
We talked about 2021. We are talking about 2021, 2022. At least you have something to say.
Thank you, Chair. Management's response on the same was, the management acknowledges laws guiding the submission of financial reports for auditing by 30th of September, and that submission was due to the fact that the fund account should be receiving funds appropriated by the county, which has never been the case. Thus, the management did not have clear information whether to submit to the financial statements to the Office of the Auditor General, since Kisumu County Social Health Insurance Fund was not among the entities that were to submit their financial reports in the list provided by the county treasury. We, however, apologize for the late submission, and this will not occur again going forward. Thank you.
Admin, you are still coming up with such kind of answers, given what we discussed in 2021, because that could have informed what we are talking about now. Or maybe you have forgotten that was answered.
Thank you, Chair.
And you apologize. Your office apologized over this issue, and now you are repeating it.
Yes, we did apologize as management. But remember, we received In 2022-2023 is when we got a letter that wanted us to be audited as a fund. So that is why it has appeared in 2021, 2021, 2022.
Okay, it is fine, maybe, but a director knows what is required of him. He's aware, but he had talked about it.
Thank you.
So maybe to the members, if you can get some encouragement so that they know, they understand what is expected. Thank you. Honorable Akwach.
Chair, I think the administrator would have provided the list that they got from the county treasury, because they have said that there was a list from the county treasury which exempted them from providing the statements. So maybe they would have adduced that list so that we see that they were not instructed to adduce the statements.
So that we know how to help you. You know, we can help you. We are here to help each other. But you had a list. Did you provide a list to the auditor? Maybe that would have exempted you from...
We had a communication in 2022, 2023, and now that list was including Kisumu County Social Health Insurance to prepare the financial statement and submit to the Office of the Auditor General. We indeed provided, presented the financial statement on time for the financial year 2022-2023. So being that there were balances brought forward, the auditors now wanted us to present the list, the financial statement for the two since the fund started. So that's why, sir, that query is appearing in 2021 and also in 2022. But as I indicated...
On a point of order, Chair.
Thank you, member.
Chair, just can't quote, but in our standing orders, it's not right to anticipate debate. We are not yet discussing 2022-2023, and Director of Finance has jumped to 2022-2023. I think we are in 2021-2022. And that's where we are. I've not even seen the 2022-2023. The question is, in the previous one that we've discussed, and you said you are going to change in the next financial year. Now we are in that financial year, and you have not changed. 2 consecutive years, you are reporting late, and you know it's against the law. Why I'm holding this against you? Because I know, you know so well, that funds must be audited. And for funds to be audited, you must provide documents in time. And you fail to provide on 2 consecutive years. 2 consecutive financial years. Chair, I think we forgave them in the first year. Now we are in the second year. I know the Bible says 7 times 77 times, but this is an assembly. It's not the Bible. Thank you, Chair.
What would you have any reaction? If you don't have, it's fine.
Chair, we are well guided by the members of the committee, and we really apologize for that.
Yeah. You really? This is now the second apology, Director. We'll make a determination on that. Next question.
Thank you, Chair. The next question is on lack of performance reports and monitoring and evaluation reports. The issue reads as follows. During the Kisumu County Social Health Insurance Fund performed their mandate as prescribed in the regulation. However, the management did not provide performance reports which related to the performance of the fund. In addition, the fund did not have monitoring and evaluation reports as required by the regulation. In the circumstance, management was in breach of the regulations. Thank you.
Back to the accounting officers.
Thank you, Mr. Chair. It is true, by that time we didn't submit, but performance reports and monitoring and evaluation minutes of the oversight are here availed. You can refer to Annex 4 of the same.
Back to the auditors.
The management has not provided performance reports and monitoring reports from the oversight committee, which is the overall oversighting the performance of the fund. What they provided is a report which is not signed by the oversight committee. That is what they submitted. Thank you, Chair.
Could you please confirm? It's like you provided half a report. Maybe
Thank you. Thank you. We gave a report on the utilization reports, and we understand that what is needed is the monitoring and evaluation. So these had formed part of our discussion during the oversight meeting, and we agreed that going forward we're going to have monitoring and evaluation committee that will be evaluating the fund. And I want to confirm to this house that since we had that meeting, Dr. Famis, who is mandated to health insurance, our coordinator, is the champion for that. So she has been developing report on that, and I think it will not appear again in the subsequent audit reports, because by that time there was no audit evaluation and monitoring committee. But we appreciate what was raised, and I think it makes us to look at the things that we were not doing and discuss the way forward on how we are now going to do them. But the utilization of the funds and how it is also being from the NHIF was provided. It's only that that one was not signed by the oversight committee chairperson.
that's right. While you are going on, there's a member who got into the house. It's our chief whip. Chief whip, it is advisable you introduce yourself so that we know. Thank you.
Thank you, Chair. I am Honorable Sethu Chinkanga, member of County Assembly representing Market Milimani Ward and at the same time Majority Whip. Thank you, Chair.
Thank you. You're welcome.
Thank you, Chair. The next question is on lack of an internal audit review. It reads as follows. During the year under review, there was no review of the fund's activities, contrary to Regulation 153.1 of the PFM Act 2015, which requires that the internal auditor should review the effectiveness of the financial and non-financial performance management systems of the entities. In the absence of constant reviews by the internal audit unit, the effectiveness of internal control and risk management in relation to the fund could not be confirmed. Thank you.
Back to the accounting officers.
Thank you, Chair. Kisumu County Department of Finance has mandated one of the internal auditors who will be conducting quarterly audit review in order to enhance the internal control system as far as the management of funds are concerned. Thank you.
Auditors.
Thank you, Chair. Internal audit review reports has not been carried out on the fund so far.
How do we understand that truly there's one person who is now assigned from the audit department to help you on these issues? How do we? Is there any evidence to show that you have made some effort?
Yeah, we have attached a letter written to the Office of the Auditor, Kisumu County Internal Audit, requesting for an officer to be attached to Marwa. So this officer is actually is now an internal auditor in the Department of Health, and will be responsible also in terms of looking at the books of accounts for the funds within the health department. As we were coming here, we were still not able to get the letter, but the officer has is now in the Department of Health. But the letter requesting we have attached.
Back to the members.
Thank you, Chair. You know, when an officer responds and he says that there's a letter to that effect, then he should be able to give that letter as a document to the committee for authentication. Because this is an audit committee. So when your committee is supplied with an evidence in statement, then for the committee to be satisfied, then a letter to that effect should be able to be availed to the committee. Thank you, Chair.
That is very clear. Thank you for that oversight. It's very clear. You said you sent it to? You sent the letter to?
We requested the internal auditor. We wrote a letter to the chief finance officer, and the letter that we wrote has been provided and attached as one of the appendices. So what we were not able to get was now the letter deploying the officer to the Department of Health.
So a member is asking about where is that letter so that we confirm it is truly, yes. And confirm from that. This page. The page is numbered so that we give. Is it there? But if you send it to the auditors, they are not acknowledging that letter in their response. Is it true that you did it at the right time? They are also here.
Chair, I think here we should really dig deep into this. Remember, these are administrators of this fund. So sometimes if you are an administrator, you are the one who is being audited. And you are the one who is even writing. In this case, you are the one writing a letter to the auditors to come and audit you. While we have got the Department of Finance the CEC member for finance who should ensure that these entities or these fund accounts are being audited by the internal auditors. So to me, I think it is the responsibility of this Waziri Finance who should ensure this is better placed to answer this question. It's better placed to answer this question because he's the one who should ensure. He sits right on top. And if he writes a letter to the internal or the committee of internal audit, then they will do their work. But this is a fund accountant or fund administrator begging the office of auditor, come and audit us. You see, so this is a question that we should direct to the Waziri Finance. Even if there is a statement to that effect, then we should do it so that they set the record straight, other than dealing with the administrators. Because even today, if they go and write again, and the office of the internal auditor does not come to audit, what will they do? And they are not even the bosses of those people. So let us handle the bull by the horn. Thank you.
I saw you.
Thank you. This letter, the date is 23rd August of 2023, when they requested for an internal auditor.
Fund managers.
The audit indeed delayed due to late submission of the audit reports, of the financial reports.
Thank you so much. We'll make a determination on that. We are done with the 2021-2022. Now we are going to 2022-2023. Question number 1, Office of the Auditor General.
This report of the Auditor General on the financial statement of Kisumu County Social Health Insurance Fund for the year ended 30th June 2023. The overall opinion given was qualified opinion. Number of paragraphs raised 5, resolved 1, not resolved 4. I invite my colleague to read the first paragraph.
The first issue reads as follows. Unsupported use of goods and services. The statement of financial performance reflects an amount of Kenya shillings 39,114,213 relates to use of goods and services. However, review of records provided for audit reflects an amount of Kenya shillings 35,140,998, resulting to unreconciled and unexplained variance of Kenya shillings 3,973,215. In addition, management has not indicated the health facilities that benefited from the insurance cost of Kenya shillings 11,449,066 incurred by the fund during the year. Further, these amounts described as amounts paid to indigents in the society could not be traced to the specific individuals. In the circumstance, the completeness and accuracy of the reported amounts on use of goods and services could not be confirmed.
Accounting officers.
Thank you, Mr. Chair. management's response on the issue raised by the Office of the Auditor General on one, unsupported use of goods and services. The amount as reflected in the financial performance of 39,114,215 and in use of goods. The support schedules were provided after the amendment of the financial statements. The figure of 35,140,998 does not include all the support schedules. The management has provided the support of schedules of 39,114,215 in Annex 1. Further, the list of the facilities which benefited from 11,449,066 shillings is also attached in Annex 1. Thank you.
Back to the auditors.
After the after the verification of the management response, management has not provided the schedule for laboratory reagents of Kenya shillings 2,331,550. Therefore, the variance of Kenya shillings 3,973,215 remains unreconciled. In addition, we could not trace the amounts paid to the indigents to the specific people.
If you have something to say, before I give to members.
Thank you, Chair. We realized that the attachment for the ledger for laboratory reagents was mistakenly not attached to the schedules provided. But if you allow me, Chair, I have with me here the schedule for the laboratory reagent. So if you allow me, I can table it. That is on the only schedule that was busy. Okay. Chair, on the issue of the amount not being traced.
Just, I confirm having received the schedule for laboratory, which was in question here. And we want a copy to the auditor. We want a copy to be taken to the auditor for verifications. I hope you are you have a copy. Do you have a copy for this now? Okay. It's the same. Hand it over to the auditors. We'll continue now.
On the query on the amounts could not be traced back to the individuals, we had a discussion with the auditor. They wanted to know how the reimbursement that we now gave back to the facilities, how were we able to arrive at the amount? And we use what's called MTBA platform or Marwa billing platform. And we agree that we provide an evidence of the individual utilizing services in these various facilities. So, Mr. Chair, with me here, I have a report, an invoice report for one facility here called Ahero County Hospital, showing each and every member of the indigents that has benefited at that particular facility. So this one will be able to confirm that indeed our indigents are receiving care in these health facilities. So if you allow me again, Chair, We were not able to submit this within the time, but if you allow me, I can table this now, sir.
This is just for one, like this one. Okay. I acknowledge the receipts of invoices, receipt of the beneficiaries, of which entity? Ahero Sub-County Hospital, as a sample. Is it a sample? To confirm how they are receiving their benefits. Okay, thank you. One copy is to the auditor. Knows if this the document is looking for. One to the auditors. So the matter is subject to verifications by the auditors and the committee. We will make a determination of that. Next question, piece of the auditor. May I give a direction? That should be the last because some of them we have seen. Yes.
The issue is on incomplete fixed assets register. It reads as follows: the statement of financial position reflects an amount of Kenya shilling 689,062 relating to property, plant, and equipment. Review of the fixed assets register revealed that it was incomplete as it did not have information such as asset value, description, serial number, supplier's name, original location, current location, and officers responsible for each asset and the asset condition. In addition, the physical verification of the assets during the year and a review revealed that they were not tagged to confirm their ownership by the fund. In the circumstance, the accuracy and completeness of the reported property, plant, and equipment balance of Kenya shillings 689,062 could not be confirmed.
Back to the accounting officers.
Thank you, Mr. Chairman. Management's response on the query raised by Office of the Auditor General on incomplete asset register. The complete asset register with the required detail has been provided and attached in Annex 2. Thank you.
Back to the auditors.
Thank you, Chair. After verification of the management response, management has not provided a complete fixed asset register showing the serial numbers and asset condition. What was provided had the date of purchase, quantity, description, costs, depreciation, and net book value, and current location. Thank you, Chair.
It is confirmed that there's a lack of many requirements in the reporting template. I hope you must be having a reporting template which is specifying what to be reported. But the auditor, you are talking about providing, and the auditor is saying there's a lack of more information, clarity on what is provided. Director?
Thank you. Thank you, Chair. We acknowledge that those critical details are missing, such as the serial numbers for these specific items. However, the individuals that are having them has been we have shown in the schedule. So once we receive these tablets from our store, we have County Department of Health asset register. So what we are able to retrieve when distributing these things, we had to indicate the list of the assets it has, but the full asset register is in custody of the Department of Health. But we are saying that we'll be able to amend this if given time, so that we include the serial numbers for those specific assets that were purchased. And going forward, we have also received a new template from the National Treasury, and we'll continue to abide by that particular template. That one will be now under the custody of the fund. So in the current audit, it will, if will be audited, we have the new template from the National Treasury that we're going to use.
Members, and talked about some of the documents are in the custody of the health department. Do you have any letter to justify that you wanted such kind of, maybe they delayed? Did you make an effort? Do you have any evidence to show that you made an effort of getting them, but due to time, maybe, or that was also an oversight?
We may not have that evidence as per now, sir, but given time, we can provide that evidence.
So, Director, next time, we deal with laws and order. You don't leave critical documents behind, because those are what will shield you away from problems in the house. So if you have all these things, any letter justifying that you made an effort, obviously you have to carry with you that letter, so that we don't get into things we now handle the department directly. But in the absence of that, surely we can't blame the department, because there's no effort, there's no evidence of an effort made by the entity in question. So those are very critical documents. You just write a letter, come up with such kind of letters. Now we talk about that. And remember, we will be asking for the dates of the letters, just as we asked the other one. We'll be asking the date of the letters, because you can be writing a letter to probably pass through auditing queries and all that. So the time of writing the letter is very important. Even if you do it now, there's no problem, because by next year we are here with you. Okay. So those are some of the things which you must observe very clearly. Members, I think we are coming to an end of the exercise. And before we leave, we are going to give the auditors opportunity to give us some quick ones, maybe observations and pieces of advice on the way forward on this kind of matters. Yes, it is very important. Members, you will also be giving us a closing remark on this issue. And before we give members, we will, from the auditors, we will be giving the accounting officers. Then finally, we are giving the members. So, Office of the Auditor, maybe one of you, closing remark.
Thank you, Chair. Let me say I have seen good deliberations within the committee, and I think the observations that have been made have will ground the fund to deliver services to the people. Thank you, Chair.
Thank you, Mr. Chair. I want to take this opportunity to thank Office of the Auditor General, the PICPAC committee, and even my management team. Auditing is a process, and it's an eye-opener for institutions to ensure that they do their things diligently and in acquired process as per the PMF Act. So most of the things that have been raised by the members, I do believe as the fund administrator and the team that I have before me here, we will work hand in hand to ensure that it doesn't appear when we appear before this house or before this committee the next financial year when we'll be audited. Otherwise, thank you very much. We've learned a lot from the committee and Office of the Auditor General. Thank you.
Matara, Nancy.
Thank you, Chair. I just want to appreciate the management and to appreciate the auditors for making time to be here. Actually, I'm so impressed today that the management was so well conversant. Not like we are not aware, but today at least I can give you a congratulations, kudos for that. And whenever we call you here, we don't call you that we want to grill you, but we want to make our Kisumu great. Yes. Sometimes people do fear coming here that, yeah, you see, no, we only want to make Kisumu great for all of us because you never know what you have to, for us tomorrow. Thank you so much.
Honorable Akwach.
Thank you, Chair. Chair, mine is also to appreciate the Office of the Auditor General for the support that they have been giving. And also to the PICPAC committee members and the Secretariat for having taken our time to go through the reports and then be here on time. You know, today is a public participation day, and you can see most of the members of the County Assembly of Kisumu are not within. But for us, we had to make time to be here because we really love our county. To the management, I also have to appreciate you. And this is a common understanding that the Kisumu County belongs to all of us. Let us join hands so that we ensure there is prudent use of resources in Kisumu County. At the same time, let us continue improving on our management so that we also fly the flag of Kisumu high when we get good opinion from the Office of the Auditor. I have to say today, even when I was asking questions, I was very confident because I was talking to confident people with confident responses. Some people, when you ask them questions, they appear as if the questions are killing them. So you even fear asking more questions. Because sometimes, you know, when you get out there, think that the management will hate you because you are killing them with the questions. But for you, I have to appreciate that we are dealing with a competent team. Thank you. Continue with the same spirit.
Honorable Molo.
Thank you, Chair. I want to thank the team from the management and the auditor. I think in terms of timing, we were today on time. And I want to thank the committee members, Chair. Today, the turnout was really nice. We were a full house. And I think it is really a sacrifice. Today, some of the wards we have were having public participation on the finance bill. And we chose to be here and not going to the wards for the same purpose. But that shows commitment in this committee, and I want to thank you for availing yourself and really answering the questions we are querying. And forward, Chair, I think this is a learning process. So whatever we are tackling for the 3 financial years that we did today, the subsequent ones should be easier, that they adjust to what the auditors want and avail all the documentation that the auditors would want at any given time when they are doing the auditory process. It's a tedious process, yes, but I think they are the custodian of everything. About the assets, I think it is high time the list, Chair, be availed, plus the serials of the equipments which are there, especially the 103 tablets. I think it would be prudent for us to know their whereabouts. They might have been procured, and if they are being used or they are still in use, we should really have the register very clear, and the computers, the printers, and any other thing that really for this fund. Thank you, Chair.
Vice Chair Honorable Rindu.
Thank you, Chair. Opportunity to thank the Office of the Auditor General for their continued support and the management for their responses and the work that they are doing. My only advice will be to at least work on the recurring issues so that next time you don't go through them again. Then when you are giving the supporting schedules, make sure that you have a copy so that we can really confirm with what you are saying. Let's not just prepare them to respond to the audit issues at hand. It should be a custom and a tradition that each and every issues that require a supporting schedule, you have it in good time. Otherwise, thank you so much for your time and the work, and we still hope for the best from your department. Thank you.
Thank you very much to the members of the staff of the County Assembly. We really appreciate you because you do a lot of work on this audit queries and reports. You are guiding a lot behind the scene. It is very important that what you are doing is appreciated. To the management, we really appreciate the kind of people who are here today. We have had several accounting officers and people who are in charge of resources, but they don't explain. They don't come to explain anything. We feel disappointed at times, but we are not disappointed with you people, even though we have a lot of some challenges. But to an extent, you have an unqualified opinion. It is not easy in Kisumu County to get unqualified opinion. Surely we appreciate you, but we encourage that you continue proving that you can manage resources on behalf of the people. It is very important. And to the Office of the Auditor General, it is very important that we have worked very closely with you people. And we really appreciate the kind of work you are doing. We have a similar kind of working relationship with the Auditor General's office. We appreciate you once more because we understand the kind of work you have. You have a lot of load, maybe few officers and a vast area of operations, but we understand you have managed to deliver. Thank you so much. And to the members of the County Assembly, I'm also very happy as the chair because you have managed to forego some other duties to make sure that we attend here and serve the people within. Thank you very much. Keep on devoting your life for the people. It is the most important gift so far we can give to our people. And to that extent, we hope for the best. Improvements are going to be there. And work very closely with all the officers, be it other departments as Office of the Auditor General, Office of the County Assembly. Kindly work very closely because the focal point is the people. We work, all of us are working for the people of Kenya, the people of Kisumu County. So it is very important that we perform our duties as required. Otherwise, thank you so much for the day, and the meeting remain adjourned. Thank you. The auditor's office, you will be handled by our clerk, Austin. Thank you.